Hi, Grant Foley here at the Midwest Center for Joint Replacement. Today we're going to be stepping you through the exercises that you'll need to be doing following your knee surgery. So there's nothing that's new as far as the concepts go. All the exercises that you'll be doing now, you've completed those in your preoperative set. So if you have any questions or concerns, please feel free to reach out to our team here. We've got a great group of people that are more than happy to address any issues that you have. Thank you. Hey, it's just going to be good to understand you're going to be doing these exercises on your bed. Not everybody's going to have a table. Sometimes the bed's too soft, but that's probably the best you can do. The floor is going to be a little tricky to get up and off of with a painful hip or knee. And also want to make sure to remind you guys to do these exercises on both legs. And it's going to be really helpful to have both sides as strong as possible to recover from your surgery. We're explaining the quadriceps set, which is just tightening the muscle on the top of the thigh. Again, you've done this one in your preoperative set too, so you're just going to tighten, hold for 5 seconds, then relax, 10 repetitions. Main difference now is we're working on these 3 times a day. Okay, so you're doing a morning, an afternoon, and an evening session. The heel prop. This one's going to be 5 times a day. It's going to be more uncomfortable now since you're on the other side of your surgery. 3 to 5 minutes is your goal for the hold time. You don't want your pain levels to get above kind of that 4 to 5 out of 10. So if you can't go any longer than 3 minutes without exceeding that, you're just going to have to work on building up your time. But this is 5 times a day. You can always scoot that towel out to get the stretch a little bit more intense where there's more of the weight of the leg pushing on the knee. So to take a little bit of pressure off of it, to where you could probably go a little bit longer, slide it up towards the knee, but you don't want to get it so close to the knee where it starts allowing it to bend, okay? So that's about as far as you could probably take it to take a little pressure off of that. All right, we're doing the ankle pump here again. So we're just going to pull the foot back towards you, hold 5 seconds, point it down the other way, hold 5 seconds. It's good for circulation during your time where you're pretty inactive recovering from your surgery. You're doing those 5 times a day. So we're doing the glute set, and all Ellen's doing is tightening those rear end muscles. You're holding 5 seconds, then relax. 10 repetitions, you're doing those 5 times a day. And again, that one's similar to the ankle pump where this is just good for circulation and blood flow while you're just kind of hanging during the recovery process and your activity level's pretty low. Seated heel slide. Ellen's going to sit on the edge of the chair. She's going to slide her foot back towards the chair. She gets into that mid-level pain about 4 to 5 out of 10, maybe just a little bit further. Hold that a good 10 seconds. Let it come back out. You're going to do 10 repetitions 3 times a day. This is the main way that you're going to get the knee to bend. It's a hinge joint. It straightens and it bends. So those are the only 2 positions we're working on. The heel prop for the straight and then this heel slide here for the bending part of it. Plant, stretch into the pain about 4 to 5 out of 10, maybe a little bit further. Hold that 10 seconds, come back out. 10 repetitions 3 times a day. So now we're just going to teach you how to safely sit down and get out of the chair. So Ellen's just going to back herself up to the chair to where her legs are touching it. Let's say her right knee is the one that's been operated on. She's just going to move it forward so it doesn't get bent at an uncomfortable angle. She's just going to reach back towards the chair and sit down slowly. Alright, so now we're just going to stand up. So Ellen's just going to scoot to the edge of the chair, but she's going to keep this leg scooted forward. Good. Alright, so giving that knee room so it doesn't get bent in an uncomfortable angle. It's out straight. Again, you're going to push off from the chair. Yep. End up with a good leg as you stand up. Good. And then you can slide your operated foot back underneath of you again. Good. Just going to give you a few pointers on how to safely walk with a walker, and also make sure that you're thinking about the right things so that your walking pattern gets off on the right foot. So all we're going to do is just move the walker forward slightly. You're going to take a step with your affected leg, the leg that you had operated on, and then step forward the other foot. So that's the step pattern we want you to use. So you're going to move the walker forward again. This time, Ellen, make sure it come back. Really bend that knee as you bring the foot forward. Okay, so we want that to kind of be what we call a heel to toe pattern. So you move the walker, step with your affected foot. Good. Make sure you bend that knee. You don't want to walk stiff-legged. So good. Heel goes down first, and then you push off on the toe. Okay, so the walker, push off on your toe, put the heel down. Good. Act like you're stepping over something with that foot, really to over-exaggerate kind of how you're bending that knee. Deal with stairs here. When we talk about stairs, hopefully the first couple of weeks you're not messing with them much anyway. We're talking about curbs or maybe 1 or 2 steps from a safety standpoint. So what we're going to do, Ellen's just going to hang onto the rail here. I understand we're going to just teach the concept. This isn't really an ideal set of stairs to kind of teach you on, but this could replicate maybe a curb. So if Ellen had surgery on her right knee, she's going to go up with the good leg first, which means she's going to lead with her left leg if she had surgery on the right side. So you go up with the good leg first and then bring the other one up. Good. All right, so now we're going to be talking about going down the stairs. So Ellen, again, had surgery on her right knee. You're going to be going down the steps leading with that leg. Okay, so hopefully you've got a stair rail to hang on to stabilize yourself for balance. So Ellen's just going to hang on, step down with the right leg first, and then bring the left leg. Good. So the bad leg or the affected leg comes down first going down the stairs. If she got that mixed up, so come on back up to the stairs, up on the step. If she tried to lead with her left leg first, which is her good one, it's going to leave that right one, which she just had operated on, holding all of her weight, trying to lower it down. Okay? So stairs, you lead going up with the good leg, the unaffected leg, and on going down the stairs, you lead with the affected leg or the leg that you just had operated on. So this is going to get into the set of exercises. We're going to start around week 3. The weeks from the time of your operation to week 2, we had you on a simpler set of exercises. So we're going to incorporate a few more that are just a little bit more challenging, mix it up some. So we're going to start on the straight leg raise here. You're going to bend one knee up, keep the other knee flat, pull the foot back towards you so it's pointing straight up. You're going to lift about a foot up off the bed. Pause for a second, come back down. You're going to do 10 of those on the right, 10 of those on the left since we're doing both legs. And we're just going to do that 2 times a day, okay? So that's the straight leg raise. Make sure on this one, again, if you get more irritation above maybe a 4 or 5 out of 10 discomfort, you're going to have some discomfort across that knee. You just don't want it to be sharp, upper level, above kind of that medium pain range, okay? If that's the case, just go ahead and back off on this one. Some of the other exercises will still continue to work on what this is trying to achieve. Incorporate the calf stretch with your towel again. Okay, so Ellen's going to hang on to that. I'm going to pull that foot back towards you till you feel the stretch in that calf. You're going to hold that about 10 seconds. Relax. You're going to do 5 repetitions on that. You're going to do that 3 times a day. We're going to do the standing heel raise again. So Ellen's just going to lift her heels up off the ground, using the chair just for balance. Come back down. So she's just pausing up there just for a second. Lift up, come back down, good smooth controlled motion. Do a set of 10. Once you do a set of 10 for a couple of days, make sure that feels okay. Then you can add a second set of 10 in, and we're going to do those 2 times a day. Okay, so the standing calf raise. Okay, so we're doing the seated hamstring stretch. And Ellen's going to sit down, scoot to the edge of the chair. Going to do this on both legs. So we'll start with the right. Pull that foot back towards you so it's pointing up towards the ceiling. Then she's going to lean forward from her waist, far enough to where she feels the stretch back here in that hamstring. Hold 10 seconds. Back off of it. You're going to do 10 of those repetitions 2 times a day, both sides. All right, on page 23 of the handout in the booklet that you were given, that's on kind of the weeks 3 and 4 exercises. This is for the hip and for the knee. And we just wanted to mention something about managing your activity is challenging during this stage. And for the most part, especially weeks 0 to 2, you're just in recovery mode where your activity levels is pretty minimal. It's just necessary trips, activity in the house, to the restroom, getting a bite to eat or something to drink in the kitchen. Car trips at this point don't tend to go very well. So other than just trips to the doctor, we have a lot of people that try to go out and tinker around the garage and roam around the yard. So the amount of time that you spend up on your feet is directly related to that pain and swelling level. So really that first couple of weeks, only the necessary level of activity in and around the house. The threshold for those tissues in the area where you've had your surgery is still just very low. So it just doesn't take much activity to irritate that beyond the point it's already going to be uncomfortable anyway. So if your pain levels in the evening, swelling levels in the evening, and at nighttime it's tricky to sleep anyway, are starting to climb, you may just monitor your activity level to make sure that you're not exceeding that. So in weeks 3 and 4 that can bump up a little bit more, but still car rides aren't good. Trips out to eat where you're seated for a long period of time. The seated position, again, the car, it's just not a fun place to be after you've had your operation for the first few weeks. So folks that are super motivated, we understand that they're wanting to get moving, but at the same time, you really have to just manage your activity. Do your exercises, be consistent with your exercises, but for the most part, the running around activity needs to be pretty minimal to make sure that you're not exceeding those thresholds.